Now, capsules cannot be equivalent to carrot.
Correct.
And proteins, minerals, vitamins still grow on plants. You can't just process and take a pill and say, now the supplements are done and I'll be completely okay. So if you concentrate more on the proteins, amazing things will happen. Your muscle loss will also be halted. When there is good amount of protein, the satiety also is there for a longer period of time. Hair loss is always equivalent to the amount of nutritional deficiencies the patient has. If the patient has started putting on weight, that means
Welcome to another episode of Health Charcha Season 2 with Medtronic, the podcast where we simplify healthcare, share real-life experiences, and explore meaningful medical conversations. I'm your host Kartik, and today we are turning our focus to a topic that impacts every single person, every single day: nutrition. Whether you are recovering from illness, managing a chronic condition, or just trying to live your healthiest life, understanding your nutritional need is key. From vitamin supplementation to the right amount of protein and fluids, the decisions we take about nutrition can significantly impact a healthy well-being. To guide us through this conversation, we are joined by Dr. Prashant Salvi.
hi.
Dr. Prashant Salvi is a leading bariatric and metabolic surgeon heading the obesity program at Jupiter Hospital. Thank you so much, Doctor, for sparing your wonderful time, and I hope we are going to enjoy this session.
Pleasure is always mine.
Let's begin with the basics, Doctor. Could you just help us understand the role of nutrition in preventive health? And while we are talking about all of these, especially with the people who are suffering with obesity.
Correct. So, when you talk about nutrition, it is the backbone of a good health. Now, a lot of been talked about nutrition. Now, people know that protein again becomes an important aspect in the diet. But when we see nutrition as such, we as Indians don't focus more on the nutritional aspect of the food.
Correct.
Now, we also call it as food is called as medicine. Now, it is not just poetic, but it is backed up by good scientific data also. We have certain amount of food which can help prevent diseases like diabetes, can help prevent cardiovascular diseases. Also, when you see certain foods which can increase our immunity also. And that is the reason why we say that food is medicine, food is God. Now, what happens in obese patients? These patients, they lack a lot of multivitamins. They lack the nutrients such as D3, which is very common. Now, if you see India, we have ample amount of sunlight. But the way we leave our office, when we leave the home before the sunrise and come home in the night when the sunset is already done.
Correct.
Because of this, we don't have exposure much. So we have a lot of deficiencies concerned to vitamin D. B12 again, it's always said that vegetarians lack a lot of vitamin B12. But no, it's that even non-vegetarian people, they lack good amount of vitamin B12. Now, especially in obese patients, because of the absorption issues, they always have B12, D3 deficiencies common in their particular profile. So when we see obese patient as such, we know without even getting their investigations done, we know that these patients are going to be having deficiencies. But there are some subtle signs wherein if you feel lethargic the entire day, if you feel that your energy is low, you are having repeated cough or maybe repeated cold, so that means that immunity is going for a toss. And that is where you need to investigate, understand that there could be some nutritional deficiencies and correct it. So either you can do it by getting the investigations done with the help of a doctor or a physician or a dietitian. And that's how nutrition plays a very important role in the entire preventive medications.
Doctor, you rightfully said that food is actually medicine. But these days, the talk of the town is actually becoming obesity. And a lot of youngsters are also becoming obese. What are those most common nutritional deficiencies that you encounter these days, especially in obese patients?
So like I said previously, vitamin D, which is most common, vitamin B12 also, more common. Also, not just obese, but also in other patients also, we'll see a lot of iron deficiencies. Now, especially in females, because of the menstruation, they have iron deficiencies, but also people who do not take adequate iron-rich food, they can also land up having iron deficiencies. Also calcium, which is very, very common. Now, what is happening is you do not concentrate more on the calcium aspect, magnesium for that matter. You will see a lot of patients having sleep disturbances that can be amounting to magnesium also. Now, when you see calcium deficiencies, that directly impacts your bone health. Then you might have pathological fractures also if the calcium deficiency is there. So these are the couple of nutrients which need to be taken care of: D, B12, calcium, iron, magnesium. So these are the few examples wherein deficiencies will definitely happen if at all you're not taking supplements on time.
Doctor, I am sure that, there are going to be patients who might reach out to you post-surgery because you are a bariatric surgeon. And of course, there are those challenges that patients usually feel post-surgery. It can be from simple sign and symptoms like nausea to other, vital sign and symptoms that their body keeps on showing. So what are those feedbacks that you have received from the patients post-surgery as a bariatric surgeon, especially when it comes to nutrition?
Yeah, so as a bariatric surgeon, what we do is, as a surgeon, what we do, we decrease the size of the stomach. And what is bariatric surgery? We decrease the size of the stomach so that patient eats less. Now, imagine a patient eating less. Obviously, the nutrients also would be eaten by the patient little on a lesser.
Correct.
So these patients, when they undergo surgery, we make sure that they are a good amount of proteins, a good amount of multivitamins. Why? Because if they have deficiencies, and sometimes when we create a malabsorption, when a bypass for bariatric surgery, we create a malabsorption. So we make that patient's entire anatomy change. So because of malabsorption, because of the decreased intake, these patients ends up having deficiencies. Now the most common could be thiamine deficiency. Patient will keep on vomiting. We'll feel because it's because of the surgery, but that could be thiamine deficiency. Some patients, they start losing their hair, and that could be because of proteins also. So all those deficiencies taken into consideration when we see patients after the surgery, we make sure that they are on a good amount of nutrition supplements, proteins as well as multivitamins. And as and when they start losing weight, they also lose the muscle mass. Now for that, we again put them on a good amount of protein supplements.
Correct. Now we are talking about protein. Protein is another key area to actually emphasize on because we live in India and vegetarian diet is pretty common in our country. And when we relate protein, it automatically, transforms into a non-vegetarian diet. Like most of the non-vegetarian people have maximum protein intake. Like I said, vegetarian diet is very common in our country. Do you think there is a protein gap, like intake, in terms of intake, when we see people who are vegetarians compared to the non-vegetarians?
So, very valid question. See, protein is something which is rarely talked about. Proteins, when we talk about vegetarian and non-vegetarian, when I see patients in the OPD, I don't see that much of a difference between a vegetarian and a non-vegetarian. Because the way we eat the non-vegetarian food also,
correct,
it's not sufficing or it's not giving you that adequate grams of proteins. Now, if you see a minimum requirement for any individual, it's at least 0.8 to 1 gram per kg body weight daily. That's the protein requirement which we require every day. But we never harper upon that particular aspect. Now, what happens in a vegetarian diet? There are good sources of protein in vegetarian food also. But how much to take? Whether it is which source of protein, we don't harper upon that. Now, what I usually tell my patients is, whether you're a vegetarian, non-vegetarian, you make sure your plate contains protein in each meal. Breakfast, there has to be some protein. You always have to ask question whether protein is there in that meal or no. Breakfast, lunch and dinner. So if you concentrate more on the proteins, amazing things will happen. Your muscle loss will also be halted. When there is good amount of protein, the satiety also is there for a longer period of time. Now, I'll give you a biggest simple example. Now, you are hungry and you take maybe fries or something, some simple carbs. You will immediately be again hungry within an hour's time because these simple carbs are not good. Instead of that, you have some protein. Either you have oats or milk, or maybe you can have some grilled chicken. What that will happen, your satiety would be achieved for a longer period of time. You will be full and you will not be hungry on an immediate basis. So proteins always give you satiety and that helps you reduce weight also. Plus that the muscle mass is also quite well taken care of.
Well, doctor, when we were talking about nutrition, you beautifully brushed the cheeks of vitamin supplementation. And it's one of the most talked about things these days. Everyone really wants to be fit. Everyone wants proper nutrition, and vitamin supplementation is becoming the talk of the town. It's one of those terminologies that are being Googled on the internet every now and then. With so many options available out there in the market, do you think people at this point of time really know what sort of supplements do they need to take and how much supplements do they need to take when it comes to vitamin as a nutrition part?
So supplements, I would rather say that supplements is only to bridge the gap of nutritional gap. It should not be a replacement for food. Supplements will always be a secondary thing.
Okay.
Primarily, it is always your food Now, capsules cannot be equivalent to carrot.
Correct.
And proteins, minerals, vitamins still grow on plants. You can't just process and take a pill and say, now the supplements are done and I'll be completely okay. So that should not be the notion. Now, when I talk about supplementation, multivitamins, there are a lot of things which are there online. Or people just watch something on the internet and then they start following. But there can be toxicity also. Like, for example, if you take a lot of vitamin D, you take a lot of magnesium, that will impact your other organs also. Even when we talk about proteins, now let's say the patient has some kidney issues and they are not aware of that, and they take good amount of protein because it's been talked about you require 1 gram per kg. They take good amount of protein. What will happen? Their kidneys will go for a toss. They would have dehydration also. So supplementation, whenever required, always to be taken under guidance. Now you just can't just take supplements over the counter and start eating it without even thinking about whether it is required for your body or no. So if at all your body gives you symptoms, the body is the best thing. The symptoms can be given by the body. They'll hint. The body will say, okay, you are not doing well. You are fatigued all the time. You are having, you are lethargic most of the time. Then your body will say that there is something wrong. Get investigated. See your dietitian. See your physician. See your surgeon. If you are especially after bariatric surgery, see your surgeon. They would definitely guide you with multivitamins. So that is a way the supplementation should be given. You cannot just take on-the-counter medications.
But doctor, we are living in a world where everything is available on a 7-inch or a 14-inch screen, and people tend to, go for the way that's called self-supplementation, because everything is just one click away. All you got to do is write up a prompt on a search engine and it gives you multiple feedbacks in return. And that's what people are actually consuming through internet. What are those major risks that people should be aware about when it comes to self-supplementation?
So, like I said, self-supplementation is always really bad. So, simple thing what I'm talking about is proteins. You take even the protein, your kidneys are going to go for toss. You take vitamin D excess, that is also bad. Now, even the fat-soluble vitamins, the vitamin A, D, E, K, you take those vitamins to an excess because lots not been talked about vitamin C, vitamin A, and people feel, yeah, they can take it. But if you take that, you are damaging other organs also if there is toxicity. So there are limitations for all the supplementation. So without understanding what is your body value of the supplementation, you should not be taking supplementation like that.
And one more thing, doctor, before we move on to our next segment that I really want to ask you is there is always a differentiation that is being done when it comes to society, when it comes to the internet, between men and women. They say it's easy for men to actually lose weight compared to females. What is that one thing that you really want to say when you hear all such statements being outspoken in the society?
That question, I would rather take it with the experience what I've seen. Now, when I see patients, obese patients, men and women, so when I do a body fat analysis of this patient, you tend to see a lot of percentage fat in females.
Okay.
And so the deposition of fat over periods of time, that causes a stubborn fat, and that's difficult to lose. But on an average, if you see, men tend to be a little more active as compared to women because they have broader scope. They have no family responsibility as such. But females, they get completely engrossed in the household chores. They have to take care of the children also. So for them, the activity levels tend to little lesser as compared to male. So when you try to reduce fat also, men try to reduce fat at a faster pace as compared to females. And the females have to work a little more harder on that. So I would see the gender difference. Yes, there is a little bit of more fat deposited in females as compared to male. And the work to reduce the fat, the female have to work a little more harder than as compared to male.
Dr. Prashant, I have few myths that I really want you to bust. And these are some common nutrition myths that people tend to find answers on the internet or even in their regular societies or reaching out to the doctors. The first one says, you don't need supplements if you eat 3 meals a day. What's your take on that?
So it's a myth. It's a dangerous myth like that. Say if you eat 3 meals a day, do you know how much is the nutritional value of that meal? Now, when I said that the protein has to be there in each and every meal.
Correct.
But if you have good amount of meal, but there is no nutritional aspect to it, then it is not done.
Okay.
So even if you take 3 meals and that meals doesn't have the adequate amount of the supplements or the nutrients in that, it is useless. So just by taking good amount of food, you can either feed a disease or you can prevent a disease. So what you eat, you have to really be conscious about. You have to count your calories when you eat. If you decrease your calories and if you have good amount of protein and other nutrients, the meal will be the best, fuel for your body.
Well, coming down to the second myth, and this is doing really big rounds, not just on the internet, but in your friend circle, in your family sphere as well. Protein is only for the bodybuilders.
So that's a scary myth. So I would rather say that protein is not just for bodybuilders. It is for anyone who is having a body. That means any person, a kid, an adult, an elderly, men, women, everyone, they require protein. Like I said, 0.8 to 1 gram of protein is required every day per kg body weight daily. Now, for a patient who's undergone bariatric surgery or a patient who's recovering from obesity or a patient who's recovering from any kind of a surgery for that matter, they would require a little larger amount of protein. So that can be 0.26 to even a good amount of 1.6 grams of protein per day. But that's not just a myth. That is just not like you can't give it to anyone. They require protein. Protein are the building blocks of your body, and enough proteins is required for daily metabolic activities.
The third myth, multivitamins can actually replace fruits and vegetables.
Yeah, no.
Now, so, every mother will actually disown this statement, but please go ahead.
So fruits and vegetables, like I said before, that carrots cannot be equivalent to capsule. So multivitamins cannot replace your fruits and vegetables, because these fibers which you get from fruits, the vegetables which give the antioxidants, they have to have it by the way the food has been taken. You can't put it in a capsule because it works in a synergy. When you take some fruits or vegetables, they work in a synergic way in your body and gives you that much of supplementation. But then in a capsule, it's not possible to put everything in a capsule and take it.
And one of the most searched and one of the most common water cooler conversations, pills for weight loss.
Yeah, so that's been talked about a lot. I mean, you are seeing so many, I mean, I would not take the name, but you see so many people losing weight drastically. So a lot has been talked about medicines for weight loss, injections for weight loss. But what is not talked about is the side effects, what these medications can do to your body. When you start losing weight because of the medication, you lose good amount of muscle mass also. Now, when you stand on a weighing scale with the medication, you just see the numbers going down. But the numbers are going down because of the muscle loss or the fat loss, you never know.
Okay.
So do not take those medications just because your friends or you see some celebrities losing weight and it's been easy over-the-counter medication. So do not do that. Get your body fat analysis done. See whether you have percentage high fat or muscle mass. How much is the muscle mass before starting on any medication for weight loss?
Okay.
I would rather say that you see your physician or see your surgeon before you start with medications like that.
One more, multivitamin dependency is going to be lifelong.
Yeah, right. See, multivitamin deficiency, what I would say is everybody requires supplementation. The food which we eat, we never think about the entire, we have to have a plate where everything is in proportion. The way we eat right now, we are more used to processed food.
Correct.
Refined carbs, there's a lot of excess sugars in a diet. So what happens is we are losing on the actual content required from the food. Now, when we talk about supplementation, everybody requires supplementation, but to an extent that it just has to support. Cannot replace your meal as such, but it has to support the nutrition so that you have a healthy life. Consider your body as a most powerful engine.
Correct.
Now, if you fuel it rightly, you will have a long-lasting effect. But if you fuel it with some compromised situations, the wear and tear is definitely going to be there and you're going to be having problems for sure.
And the last one, drinking water can actually, more water can actually help you lose weight.
So, see, it's halfway true because when you drink water, it's not a fat burner as such. Water is essential for your daily metabolic activity because it detoxifies your body. It gives you hydration also. It is required for your muscles also to breathe properly. But water cannot be a sole responsible factor for losing fat. So have enough water. A minimum, what I say, is 2 liters of water every day to keep you hydrated, to keep you detoxified. And it also helps in burning the fat, but not to an extent that you cannot be dependent on only water for losing weight.
And that brings us to our final segment, that is Health Charcha Hotline, where one of our listeners actually send us their respective question. And this question actually comes out from Ravi Malhotra, who is based out of Pune. And he says, Doctor, I have recently undergone a bariatric surgery, and post that I'm facing a lot of hair fall and weight gain. What's your take on that?
Correct. So now this guy having deficiencies for sure, because he has weight loss and he has hair loss also. And when they start putting on weight, that means the equation is completely gone for a toss. My genuine advice to this person would be, now get yourself checked for your deficiencies, the amount of protein he has, because hair loss is always equivalent to the amount of nutritional deficiencies the patient has. If the patient has started putting on weight, that means the patient's diet is gone for a toss. If with the smaller size of the stomach, the patient is having high calorie food and less of the proteins, these patients can have weight gain also. So my genuine advice would be to get him back on track, so that the weight loss is maintained for a longer period of time. So he has to have good amount of proteins, so that he also has a good control on the muscle loss which has happened, and the supplementation. So for hair, for nails, for the muscles, everything, supplementation would be important. Also, he needs to visit probably the surgeon again and understand what deficiencies he has, and do not self-medicate. These are the things which needs to be taken care of in a much, much better way, so that he doesn't have the deficiencies further, and also the weight gain has been controlled, and he would have the weight loss, a significant weight loss, and curtail forever.
Thank you so much, Dr. Prashant, for sharing your wonderful insights on nutrition. I hope you had a wonderful session.
I had a wonderful time, and thank you for the entire invitation, and pleasure is always mine.
Thank you so much, sir. That's a wrap for this episode of Health Charcha Season 2 with Medtronic. If you have been wondering about your nutritional needs, or simply want to make smarter, more sustainable choices, we hope this conversation gave you the clarity you were looking for. Until next time, eat well, stay hydrated, and remember, the right care and the right nutrition are just a conversation away. For more guidance on clinical nutrition, consult with a dietitian or speak to your healthcare provider today. This is your host Kartik, signing off.